All of the names in this story are fictional. Mary, not her real name, is a 62-year-old woman who is dying from terminal cancer. 4 years ago, she was diagnosed with ovarian cancer, which often goes undetected until it has spread within the pelvis and the abdomen. At this late stage, ovarian cancer is difficult to treat and is often fatal. The symptoms of ovarian cancer are not specific to the disease itself, but often mimic those of other conditions such as digestive problems. These conditions include abdominal pressure, swelling or bloating, persistent indigestion and nausea, change in both bladder and bowel habits, and lack of energy. Mary has undergone surgery in which doctors removed her uterus, both fallopian tubes and ovaries, and has also suffered through multiple chemotherapy treatments. However, her body began shutting down rapidly as the cancer had spread to other organs and was taking over her body. Doctors informed her that there was nothing else that could be done to treat her or cure her. The cancer is expected to result in her death within a short period of time. About 3 out of 4 women with ovarian cancer survive only 1 year after diagnosis. Mary has already made one suicide attempt prior to this. When her friends had not heard from her for a couple of days, they were concerned, so they called Mary's superintendent, who found her in her apartment alive, but she was barely breathing. She was rushed to the emergency room, where she then slipped into a coma and was put on a ventilator. The ventilator would move air into and out of her lungs and would therefore breathe for Mary. The doctors were not fully aware of her case and the extent of both her cancer and the brain damage that was caused from her suicide attempt. Because of this, they decided to leave her on the ventilator until they could determine whether her condition was reversible or what her wishes were if she had made any. Mary did not have a living will and had not predetermined someone to fulfill her medical wishes. An issue quickly arose. The doctors, they discussed, would they discontinue the ventilator or would they wait and hope that she would come out of the coma? The doctors had to consider whether by doing so they were simply withdrawing extraordinary means or committing an illegal act by assisting suicide. Since Mary had tried to commit suicide twice but failed, her healthcare proxy reasoned that the doctors should discontinue the ventilator in order to finish the suicide. According to her proxy, Mary had stated that a life with incurable cancer was not worth living. The dilemma is that in many states, assisted suicide is illegal, and the doctors must figure out what course of action the patient would have wanted. Removing the ventilator would not be assisted suicide, but rather a fulfillment of her end-of-life wishes. In Mary's case, the proxy was informed. However, before the ventilator could be removed, Mary's heart stopped and she was not resuscitated.